Ready to sell some MASA?
Yes.
I'm sorry, you came to the wrong class.
Supercharged.
I'm Debbie Scarborough. I'm from Georgia, South Georgia. I've been with AMBA for 7.5 years. And I think, as I said on stage, I didn't sell MASA the first 2 years because, my health insurance pays for that, right? Till you start filing some claims. Oh, okay.
And good morning. I'm Leanne Sturts. I have been with AMBA for 9 wonderful years already. Just live north of Atlanta in Dunwoody, Georgia, but born and raised in Michigan. So I'm happy to meet some Michigan people here today. We are going to talk about MASA Shield, as I'm sure most of you know just as much as we do, but we love selling it. So as we know, MASA Shield covers the gaps in Medicare and private insurance coverage for emergency transportation and related expenses. And I always hit on that related expenses. It is just not coverage on the air and ground ambulance ride, but so many other things. So we want to make sure our retirees are aware of that. So in the warm-up, when you're talking to Mr. or Mrs. Jones, please make sure you're listening. You know what those 19 related expenses are that MASA covers. Make sure you're listening. Do they have grandkids? You're going to hit on that, right, when you go to talk about the close. Do they have health issues that require them to maybe take an ambulance ride? Do they live by themselves with no other, relatives or friends that live nearby? Do they travel? That's a big one. Usually, 80% of our customers or retirees want to sign up for MASA because they're traveling and they know they're going to be covered for an emergency situation. And then again, how far do they live from a level 1 trauma hospital? That's big in Atlanta. We've had a lot of hospitals close. There's only 2 near them. So most cases, if they're in a rural area, they're going to be flown by helicopter, by an air jet to a major 1 trauma center, not just taking an air ground ambulance.
And everyone needs this coverage. My biggest thing, when I first really started recognizing the need, was when my best friend's roommate, and they've been friends for 15 years, was on the list for a liver transplant. I'm like, wait a minute. MASA covered. There's something about transplants on MASA. Well, I'm from South Georgia. We do not, Emory is a 3-hour drive. So he ended up in the hospital many times. And as great as our doctors are in Tifton, a couple of them made mistakes and impeded his recovery. So I sold her MASA for Chuck, because it wasn't a matter of was he maybe going to be transported to Emory. It was just a matter of time. So in January 2020, he had been in the hospital for a week, and it affected his kidneys. So she went in and said, I want him transferred to Emory. We have MASA. They went, what's that? You don't need to know, but transferring. So it was very important for me to make sure when we were fundraising for Chuck, because $10,000 was the estimated cost after Medicaid just for his transplant. So I didn't want an ambulance ride or anything else to get in that way. So he had 2 ambulance claims in 2020 that MASA paid for. So then I started looking at my retirees. I mean, if my best friend needed this coverage, I bet my retirees do as well. So young or old, healthy or not, whether you travel, I don't know about you, but I had a retiree, Dr. Collins, had her testimony in our GREA newsletter, and Mr. Tom passed away 2 months ago. But they loved sharing their testimony because they did do extensive traveling, and they did have to use their MASA when they went to Jamaica, and she fell and hit her head. So MASA sent a wing Lear jet, got both of them to Miami, and got them home. But, of course, COVID happened. Can't use that one anymore. So retirees weren't traveling. Well, now it's just a matter of an ambulance ride and feeling comfortable. My mother's ambulance ride 4 miles to the hospital wasn't fully covered. So my dad didn't want MASA, so I paid for it. He didn't know I paid for it. So it made it so much more important to start seeing those small bills for ambulance rides. I'm also in South Georgia. We don't have a lot of Trauma One centers, so they're automatically flown. So most people understand that I'm going to go to the hospital and I'm going to be flown to Tallahassee. I'm going to be flown to Jacksonville or Emory. So they understand that concept of a helicopter ride. So don't forget to go on those other benefits. But also, too, don't be afraid to ask. Have you ever been in an ambulance, Mrs. Jones? No, but my friend did, and that bill was $3,000. So don't hesitate to ask if they have, because sometimes those are your biggest testimonies.
And one of the biggest things we talk about when we're selling or talking about any of our benefits is, of course, the association endorsement. That is the biggest thing I hit on. You know, I'm in Georgia. Again, our Georgia retired educators have the hands down the best coverage in state health benefits. Their Medicare Advantage is amazing. They have a false sense of security that they are covered for emergency transports. So our biggest thing is to educate them on why their association endorses this plan. They've never heard of it. They don't feel the need for it. You know, and I always say your association would never endorse something you did not need. There's only a handful of things that they do endorse, and this is one of the biggies. And of course, with their endorsement, GREA doesn't take that lightly. They do their homework. They research these companies and alongside with AMBA decide on the best company to go with and what is needed coverage for our association members. So MASA Shield's reputation is huge. You know, after doing their homework, they have found out they're the best in the business out there. They've been in business since 1974 with an A+ Better Business Bureau rating and have over 2 million current members. Is that right, Brad? Or more? Probably more now. 2 million members worldwide. So their coverage is phenomenal. Oops, I just hit the button, sorry. Go ahead. I'm sorry. Applying for coverage takes less than 5 minutes. This is the easiest thing. Of course, we were just talking about MASA in our breakouts, or before the breakouts. It really is. The biggest thing after you've told them the need and talking about what MASA does and why the association endorses it, all I say is, you know, Mrs. Jones, which plan do you want to go with? It's the easiest thing to sign up for. You qualify for it. All you have to choose is monthly, the 5-year plan, or the lifetime. It's as easy as that. Which one do you want to go with? And it's usually as easy as that.
And educate your clients. Find out what your state and what your Advantage plan, or, you know, like us, we're in Georgia, our customers have an Advantage plan. You know, that new language with Medicare has changed, you know, may cover. So we want to make sure that we're letting them know. I had a retiree in February last year who called me. Her husband went by ambulance in Atlanta, and he passed away at the end of February. Well, 1st of August, she got a bill for $1,200, $800. I can't remember which one it was. And she says, "Don't I have that MASA thing?" I said, "Yes, ma'am, you most certainly do. Text me a copy of that bill." I said, "Do you know how to take a picture and text?" She said, "Yes." She texted me a copy of that bill. I emailed it to MASA, and it was paid. You know, even after a death, she kind of thought everything was taken care of. But sometimes those ambulance bills come, and she didn't understand why it wasn't paid at all. Medicare didn't pay anything to it because it was not medically necessary. So she was very relieved that her MASA Shield paid, and she really didn't even understand the coverage. She just knew she had something like that. Also, it's whether that deems it emergency or not. I've heard a couple testimonies that if they're not admitted to the hospital, that it could be denied. Go into a preferred facility. I talk to a lot of my retirees. I'm very thankful that Tifton has a great hospital, but it does have its negatives. If I'm having a heart attack, I need to go to Albany. So you can be transferred. I talk to my retirees because they know I travel a lot. If you're more than 100 miles from home. So you find out what they're doing. When you find out your retirees' visits, when they say they have children that live 5 hours away or even a couple states away, well, did you know, Mrs. Jones, if you're more than 100 miles from home, your MASA plan will get you home. I love that when I'm driving, because I do all in person, I travel up to 2.5 hours for a meeting, that if I'm 2.5 hours away, I'm going to go to the local hospital, but once I'm stable, I do have that option of MASA flying me or taking me home. I always tease, my husband has a government job, he's retired Navy. He could come, but I might feel safer to be at home. So when you find out what their story is, you can bring in those coverages. I don't take more than 2 to 4 minutes with a customer to explain MASA because I'm finding out where their concerns are, and then I'm filling in those parts of MASA Shield that fit in there.
She has a quick question on that.
Quick question on this slide, the very last point, and maybe I don't know if you can clarify, maybe there, going to a preferred versus appropriate facility. My understanding was if the customer asked for a specific facility and Medicare didn't cover it, that MASA would also not cover it. I'd like to know if I'm right or wrong on that.
I think I'm sorry, do you guys want to?
No, go ahead.
I think No, it's okay. Can you guys hear me all right? The clarification there, I mean, I guess is around the question is, do we cover the facility? I mean, it's the transport to the facility.
Yeah, if Medicare refuses a
Give her the
bill
mic.
because it wasn't the closest medical facility, and the customer said, well, that's not my hospital is this hospital that's 10 miles away, and the closest facility is 5 miles away, so Medicare will deny it.
I think my experience is many times in the ambulance when it's happening, especially if it's a true emergency, might not have the ability to check or pick the facility. But even if you get to one deemed medically that you need to go to the better hospital, I guess I'm saying we will cover that in both instances. Again, just the transport.
So I guess what I'm trying to get at is, if Medicare denies a claim like that,
It is.
MASA,
We will
yeah.
always go to Medicare and say, hey, maybe you're not understanding this completely correctly. We think that this should be covered. But if they're just adamant and say, no, that this is not covered, then yes, that's the benefit of us as a product. We then pay all that out of pocket.
Yes, so yeah, that's
Even
the
if it's
beauty,
the
yeah.
initial ride or the second ride,
So if you say,
getting them to
I
that.
don't want to go to this hospital, because what you said, I think your clarification is, so I go to this hospital, I'm not going to advanced level of care, I'm just going to preferred hospital. It's not like it's going to be.
It's a preference, not
It's a
necessity.
preference, it's
Right.
not a step up hospital. So what happens in that, because I know what you're talking about, that gray area.
My
They say
understanding
you can't transfer, MASA says you can't transfer to the same level of care or reduce care. It's
I
like
understand
a
now,
high-
it does need to be advanced
so it
level of
needs
care.
to be
Yes.
advanced level, like you can't just say, I'm at Our Lady of the Lake, but I prefer Baton Rouge General. Like that's the one I want to go to, and they're both the same trauma level. I would have to stay where I was.
The only caveat, and I mean, we're getting into the nuance, so this is fine. I think
Yeah.
it is a big thing, and I think, yes, I mean, if you're getting into this with the clients, it's probably making it a tough if you're going to, pick apart through the whole policy and things like that. But because there is a completely different thing, then it depends on whether the hospital is actually closer to home or not. Because you have an emergency situation, you get to a hospital, maybe you don't necessarily need to go to an advanced level of care, but there is also a separate benefit that once stabilized, we will transport you back to the hospital that's closer to your home.
Yeah,
So,
and
I
it,
mean,
stabilized.
it's just like it's a hypothetical. I mean, if we have a whiteboard here, I don't know, like drawing it out, if it's important.
Right. It's a picky question to make sure you reach out to MASA on those
Yeah.
clarifications if you have anybody that's asking, for sure. One of the things with, the Medicare and coverages is just being, again, educated on them. And we learn something new all the time when we are dealing with our retirees and claims and whatnot. But what I always say, that key word is may. They may cover you. And the biggest thing that I hear is the hospitals do not own enough ambulances. They're contracting these ambulance companies out, and they're not regulated. That is the biggest deal. So when that bill gets sent to Medicare, they're not deeming it ordinary and customary charges. They may pay some of that bill, but it's going to be a very small portion, and then the retiree is responsible for that remaining huge portion of the bill. So that's the biggest example that I give my retirees when it comes to Medicare in a nutshell about their coverage. But also, Brad, I got this last year, this little booklet on what your Medicare or private insurance would cover, or what, it's awesome. So if you don't have that, you can get a copy from Brad, or take a look at this when we're done. Do you have anything else on that?
No, it went backwards, so now we got to
sorry.
go forward too.
I keep hitting buttons.
There you go.
Okay.
Yep, forward
Okay.
one more. There you go. Using those testimonies, I talked about my America's client. She fell, and I loved Mr. Tom would tell his story that every time the doctor came in, he'd have to pull out his credit card to take an x-ray. And then they'd come in and say, well, we need to read the x-ray. So he'd have to take out his credit card again. But that morning, when he said, you need to get your wife to Miami, get her out of the States, he pulled out his MASA card, and they knew exactly what to do. So they called and flew them to Miami. I have several little ambulance claims, $250, $500. I talked to my retirees about in-network and out-of-network. When we look at our medical, we go to an in-network doctor, we go to an in-network hospital, in-network pharmacy. But in an emergency situation, we don't have a choice of which ambulance shows up. In Georgia, 80% of our ambulances are out-of-network. I did have a recent retiree that took 5 ambulance rides in 3 months. Now, the good news is her out-of-pocket was $50, but she sent me every one of those bills. That added up to $250 for her in that 3-month period. So she was very thankful for her MASA plan to pay.
We've talked a lot about testimonials. Debbie shared a lot already just in talking about how we present MASA. It is huge. It builds the trust and the need for, why they need this coverage. But having a personal experience is also huge. When I had a retiree, it was the first person I ever even enrolled in MASA. She got in a car accident. She had a huge Cadillac car, very reliable, very trustworthy car. She was blindsided, hit, her car was totaled. She actually was fine, though. This was a 78-year-old lady in Cedartown, Georgia. She got out of the car. She was fine. She did not want to go to the hospital. The police called the ambulance. They made her go get checked out and made sure she was okay. 2 weeks later, she got a bill for that ambulance ride. It was $1,700 for a 5-minute lift to the hospital just to get checked out. They didn't cover her because they didn't deem it an emergency. She was released. She, was not admitted to the hospital. So that bill was not covered at all, zero. So she was on the foot for that bill, but we sent it right to MASA, and I have a testimonial from day one, from the first month that I started with AMBA. So that's just one story I share. And if you don't have a personal story, or if you haven't heard one from one of your members on your team, there are personal testimonials on SharePoint that you could use to show members. But a lot of times when you're, just talking about this coverage, your retiree, oh yeah, my neighbor had an airlift, or my cousin, or when I was on a cruise, I saw someone being airlifted. Oh my goodness, I didn't realize that was covered, or how big that bills could be. So make sure you have some examples and testimonials at hand.
And learning what you had on the warm-up, grandkids, when selling Emergency Shield now, being covered up to age 14, that has been a big thing. Probably about 40% of my upgrades is just mentioning, guess what, Mrs. Jones? Your grandchildren are now covered up to age 14. Now, I also have several customers that buy their adult children's MASA plan because they know how important that is. And our past GREA president is one of them, and she buys for them. She kind of thinks that is her Christmas present. So I also had a recent President Lee County. When I met with her 4 years ago, she was babysitting her 18-month-old daughter or granddaughter. Well, at Albany, Phoebe just lost their pediatric trauma designation. So she knew if something happened with Addie, she was going to have to be airlifted to Macon. Well, unfortunately, about 3 months ago, Addie was airlifted at 6 years old. Most of us have heard about kids getting sick. It's not pneumonia, it's not COVID, but they've just been really sick and needed IV antibiotics. Addie was one of them. And Suzanne was texting me going, they're going to airlift Addie to Augusta. And I just replied back, you're covered. So we're still waiting for that bill to come in. But that grandmother and that mom was assured that that was going to be covered.
About the grandchildren coverage.
Yeah.
Two quick questions about the grandchildren coverage. One is there a limit to how many grandchildren you can have on it? And the second is that coverage is the same regardless of what level of membership you have?
Only if you have the emergency shield. Whether you pay monthly, whether you have a 5-year or lifetime. Grandchildren are covered up to age 14 for ground ambulance, and it's my understanding there is no limit. But see, that opens up that question when you talk about they're covered for ground ambulance. That opens up that question. But yes, Mrs. Jones, if you want to make sure they're covered, you're welcome to buy their MASA plan, or let's get Miss Marty on the phone and sign him up too.
The lifetime plan that they were, I thought it was 26. That was the good thing about the lifetime with the grandkids.
If you have a lifetime plan and you're on vacation, you take your grandchildren on vacation and something happens to your grandchildren while you're on vacation as the grandparent, that's the part that's covered.
I think you're talking about their kids under 26 on their family plan will be covered.
Yes.
Yes, under 20, up to age 26. But
No.
the grandkid coverage,
No.
yes.
Grandkids are only covered if the grandparent has them on vacation. If you have a lifetime membership, platinum or emergency shield, because I have a customer in Valdosta that takes her grandchildren on vacation every year. So she has a lifetime membership. So if something happens to her or something happens to the grandchildren while they're in her care, custody, or control, they're covered under that, only if they're in the care, custody, and control of the grandparent. Yes.
So that's how that total rent thing works.
Correct.
Okay.
Correct.
And lastly on here, is everyone here a MASA Shield member theirself? Do you have the coverage? If you're not, you need it. That's the biggest backing of MASA, is being a believer in it yourself and knowing that you need the coverage. I show my card at every time I'm visiting with a client to let them know I myself have coverage on myself and my family. And anywhere I travel or anywhere my family goes, I know we will be protected from any emergency transports or related expenses.
Yes, and I show my bracelet so they know what my ID is. So anything happens to me, they know to call my husband. They know my medication. So it's very important to sell that. And of course, with the with the emergency shield, the bracelet comes with only the lifetime membership. Mm-hmm. So
Was that everything?
next we'll go into objections. I don't think I will ever need this coverage. I'm already insurance poor. How many have heard that one? Great, Mrs. Jones. I hope you never need this coverage either. and then I go into a couple testimonies of reaffirming the need for it.
The second most common one I hear is, I don't travel, I don't need this anymore. A lot of people try to discontinue their MASA coverage, or they don't want to sign up for it because they think it's a travel insurance program. So that is the biggest misconception. I always say that first. Mrs. Jones, I'm so glad you brought that up. That's one of the biggest misconceptions that we hear about MASA. It is not travel insurance. In fact, 90%, as we just heard, 90% of our claims are within a 5-mile radius of your home. You're covered 365 days of the year, whether you're at home, on the road, or in another country on vacation.
My Medicare Advantage plan pays for ambulance rides. That's where, again, find out in your state, we have a $50 copay for ambulance rides and $75 for helicopter. But that's in network, Mrs. Jones. How many of your helicopter companies are in network in Georgia? Zero. So your in-network cost is only $75, but the helicopters are zero in Georgia. So know your state.
The last one I always hear is, I have a policy with another company that offers this same coverage for less money. I always say, Georgia, the GREA, our association, again, does its homework. They only pick out the best policies or the best companies out there to provide the best coverage. There are other companies, AirMed, SkyMed, we hear them all, MedJet. There's so many other companies trying to do exactly and replicate the coverages that MASA does, but they come nowhere close. MASA, again, not only covers every penny of every ride wherever you are in an air or ground ambulance, but all those other coverages, and no one else can ever come close. I do have a comparison chart on with me at all times, but do the research and know that. You can even look at their policy. It will come nowhere close. A lot of times you have to be in their specific air jet to be covered. So if you're in another state in another air ambulance, you're not going to be covered. MASA has thought about everything in an emergency situation, and they've got you well covered. You never have to question it.
So now we'll do questions. So, yep.
Last year at the kickoff, I think what I heard when I talked to someone at a booth, that to qualify to make a claim, the transportation must be the result of a 911 emergency call. So if someone is, for example, in a hospital being treated for illness and they need to be transported to another higher level facility for a liver transplant, for example, how does this work with MASA?
I tell my clients one or two things happen. You have pre-approval for emergency transportation always. Non-emergency transportation, call me or call MASA. But if you're being transferred from one hospital to another because of the direction of the doctor, because you need a higher level transportation, that is covered. You can give them your MASA card at the hospital. Some hospitals recognize it, some, don't know. When the bill comes in, you take a picture of it and send it to me.
My book of business is almost all expats and frequent travelers that are out of the country over 90 days often. Is it right that MASA only covers for the first 90 days out of the country?
Yes, there is a restriction. When you travel outside the United States, you do have to let them know your itinerary. And it's been several years since I called MASA about the restriction, because I had somebody was actually living over there or going longer, but I think it used to be 90 days. Brad?
We will make exceptions on a case-by-case basis, longer than 90 days. Where it gets convoluted is if they're traveling for more than 6 months at a time, it's actually considered their permanent residence because they're there more than half the year. But if you have somebody specifically in that situation, they're going to be on a trip for more than 90 days, can directly email me going through your field team leader. I'm always happy to make those exceptions. I've made the offering, and when it comes up, I see it maybe once or twice a year. So I have no problem making that exception for you.
I wrote 80 of those last year.
Okay.
Will you make that many exceptions? Because I do with people that I match it up to their Medicare.
Sure.
So they can't be out over 6 months, but a lot of them travel for 5 to 6 months, and we want coverage for the evacuation. So I've been having to use it for carrier. I don't like that.
Yes, I mean, I think when I pinpoint the numbers and likelihood of a claim being filed, even if you have 80, that's still well within the realm of our tolerance. So, I mean, you're 100% certain that all 80 of these are traveling for more than 90 days at a time each year?
Most of them are.
Okay. Why don't you take my card and let's have a side conversation? Okay, sure.
Thanks, Debbie. You had mentioned, I think it was a friend of the family or a family member that had coverage and you provided and they had services. I think you said Medicaid. Did you mean to say Medicare and not Medicaid?
No, my friend that needed a liver transplant did have Medicaid because he was 61. So he was out on disability.
So he was still able to get coverage through MASA?
Mm-hmm.
It's a membership, it's not a policy. So there's
Yeah.
no restriction.
The good news for anybody here except Florida, it's a membership, not a policy.
One exception is Tennessee.
Oh, yeah, okay, Tennessee.
Can't have Medicaid and MASA in Tennessee.
So in Illinois, that would be okay?
All right, my question is, if I'm on a cruise in the Caribbean, okay, and we're assuming under, 60 days or 6 months, do I have MASA coverage in emergency? And my brain says, okay, I have MASA, I went to Paris for 2 weeks, I need emergency coverage in Paris. Now, I have made the assumption that out of country, MASA does not cover emergency transportation. Am I incorrect about that? Or?
No, MASA covers anywhere in the world. The only thing you have to do when you travel outside the United States is 2 weeks prior, you have to send in your itinerary to MASA.
travel@masaglobal.com. Send an email with the dates and location and your member ID.
I'm going to Paris for 2 weeks, 2 weeks prior.
If you're going to Paris 2 weeks prior, I tell my customers, if you're traveling outside the United States, when you book that ticket, send me your itinerary. Because us ladies, 2 weeks prior, we're trying to
Yes.
decide what to wear, where our passport is. But as long as you do it 2 weeks prior, you are covered. Because MASA looks at a couple things. The exceptions are they won't cover you if it's a country that's in active war or there's a pandemic. So that's the other thing. You're letting them know where you're at, and they're letting you know that you're covered. So if you send your itinerary and there's a problem with that country, they're going to let you know. So that's why I tell my customers, send in your itinerary as soon as you know you're going.
All right, so I provide my itinerary for the trip to Paris, France. All right, so my coverage is in that location where I sent my itinerary.
Correct.
Okay.
So then you've got those extra coverages. You know, if you're in the hospital for 5 days, don't forget you're going to miss your probably flight coming home. You know, there was on SharePoint, it is the couple that went to Canada in their RV. They went in their RV. The last day she had a massive heart attack, and she was in the hospital for a week. MASA reimbursed the airline ticket for the son to come up there to be with them. Plus, MASA flew all 3 of them home. What happened to the RV? MASA got the RV back too. So, you know, sometimes we can get caught up in, sometimes if you can't get through the barrier of my insurance is going to pay, they know that insurance isn't going to pay to have that RV towed home. They know that no one's going to reimburse to have their son there. And that's the other thing. It doesn't have to be a family member. I tease, if my husband and I are on vacation, we go to Vegas a lot. We've gone to Texas. But my sons are 25 and 27. They're not adult enough yet to be in an emergency situation. I might want my friend. So that's the other nice thing. One of my best friends went to Texas. She was staying with a friend. She was upstairs. She was sick. She couldn't get down the steps and called an ambulance. Ambulance came and got her. If she would have had the emergency shield, she had platinum still, but if she had had emergency shield, she went to the hospital for a day. So that ambulance bill, I've already sent it to MASA, and they paid the difference. I think hers was $375. But then when she got released from the hospital, she couldn't get on a plane. She had pneumonia, COVID, and an ear infection. There was no fly-in for quite a while. So she went to a hotel and stayed for 4 days before she flew out. If she would have had emergency shield, MASA would have paid up to $500 a day hotel and meals for her. Now, MASA did pay for her rebooking of her flight to come home because she took an emergency
Okay.
plane. Any
All
more
right.
questions?
We are starting to run out of time with questions, so we're going to wrap it up. But if you have any specific questions about, the little nicks and crannies about the coverage, please see Brad or myself. I also have one of these books about the explanation of each and every one of the coverages. It's amazing. So there's, any of those questions, please see Brad or one of us at the end. But just to wrap things up on how to present this to your retirees and make sure that they're covered, MASA, everyone needs it, period. Everybody qualifies and everybody needs this coverage. The best protection is invaluable. Remember, there's other companies out there trying to do the same thing for less, but the best protection is invaluable. They have worldwide coverage and so many other coverages as well. Again, hit on that association endorsement. Your association would never endorse anything that you do not need, and they feel very important about this one to make sure you're protected in any emergency situation. Again, everybody qualifies, no deductibles, no claim forms, no questions about your health, and no dollar limits on the claims. So it's wonderful. I always say this. travel@masaglobal.com. I always say, not only can it save you thousands of dollars, it can save your life. We never want our retirees to get stuck with a huge bill, but we certainly don't want them to ever hesitate to call 911 or go in an ambulance when it could save their life.